to burden, why it is important. If we don't know the burden, we can't understand the burden, then probably will not realize the importance of the disease. And what is the application to know the burden is how frequently you should suspect a disease. When you have a patient, shall we screen everyone for hepatitis B or C, or shall we suspect hepatitis B in everyone who is presenting with jaundice or without jaundice? If you know the burden, that what proportion of people are having this disease, that will help you to define your strategy for screening, making your suspicion, diagnosis, priority, etc. So, hepatitis, as Dr. Surendra told, we have 5 viruses. A and D are enterally transmitted. They causes acute hepatitis. B, C, D are transmitted parenterally, means parenteral route of blood transfusion, unsafe injection, mother to child transmission, unsafe sex. These are the methods, and they causes chronic hepatitis leading to cirrhosis. So global estimate, if you see, you can that hepatitis is causing 1% of global death overall. So means one death in every 100 deaths in this world is caused by hepatitis or its complication. It's not a small number. There are thousands type of illnesses, and hepatitis is counting for 1% of death. Reason why we are talking so much since 2009 and 10 about hepatitis is lying in this slide. If you see, there are 4 lines showing different conditions from 2002 to 2015, the number of deaths due to each of these diseases. You can see death from tuberculosis is reducing. Due to HIV, it is reducing. Malaria is reducing. These are the 3 major global diseases for which actually the global fund is available. HIV, tuberculosis, malaria. Each country is having national programs for these diseases. But what is happening to hepatitis? This is consistently increasing. And even if we stop today, control hepatitis B and C today, this will continue to increase up to 2050 or 2060. We cannot stop this trajectory now because the consequences of hepatitis, what has happened. So that is why world is moving toward hepatitis. And second important point, which is here in this slide, you can see that death of hepatitis has already crossed death caused by malaria and death caused by HIV. And very soon we are going to cross death caused by tuberculosis. So these are the 2 primary reasons why we should know that how much hepatitis is common and what is the burden of disease. This is another important point. Total 1.3 million deaths caused by viral hepatitis, and 96% of deaths are caused by hepatitis B and C. Only 4% of hepatitis deaths are caused by hepatitis A and E. But whenever there is hepatitis, we think it is acute hepatitis, and acute hepatitis is caused by A and E. So we think that most of the hepatitis death is caused by hepatitis A or hepatitis E, but this is not the truth. Most of the deaths are caused by hepatitis B or C. How much? 96% death. And hepatitis A related death, E related death is very small, 44,000 and 11,000. This is the 2015 estimate. If you see that most of the deaths B and C, and where the B and C, how they are causing death? They are not causing death just by infection. They are causing death because of cirrhosis and because of hepatocellular carcinoma. So these are the consequences of viral hepatitis. So we should know that every cirrhotic, every chronic liver disease should be screened for hepatitis B and C. We should take this message from the slide. This is the data on hepatitis A. Just few slides about each virus. These are the red areas which are showing the burden of hepatitis A maximally, you can see, because they are transmitted through enteral routes. So wherever the unsafe food or water is consumed in resource limited countries like Africa or India, South Asia, there the hepatitis A burden is maximum. This is an important slide. Next 4 slides are very important to understand about hepatitis A. This is the typically seen in what is called hyper-endemic pattern. Your x-axis is showing the age of the participant, means the population, and y-axis is showing the proportion of people who are having hepatitis A antibody in their circulation. This is the hyperendemic pattern which is seen in India and other countries in Southeast Asia region. Means by age of 10 years, you can see 90% of people are already exposed to hepatitis A virus. And that's why when Dr. Surinder told that in adults, the most common cause of hepatitis, acute hepatitis is not A, but it is E. But in children, the most common cause is A. This is the reason. And this is hyperendemic pattern, means the risk of infection is very high. The advantage in the application of this hyperendemic pattern is there is no advantage of hepatitis A vaccination to the adults because they are already exposed. So if we have to protect from hepatitis A, we have to give vaccination in childhood, infancy, newborn to take benefit. Otherwise, they will be exposed. This is the low risk curve typically seen in developed country, US, etc. You can see here that by age of 30, when the people is their peak of productive age group, the prevalence is something around 20%. So if hepatitis A vaccination has to be given in Western world, it should be in adult also. This is the difference between the two different type of curves, right? And every other country is lying between them. So we are in one extreme where vaccination for hepatitis A is to be given in childhood, and the US and Europe is in other extreme where vaccination has to be given in adult age also. Hepatitis A epidemiology, burden, etc., prevalence, you can leave it. Then hepatitis E virus WHO document, this was prepared by Dr. Rakesh, global prevalence. Again, the burden, wherever A is heavy, most of the time E is also heavy. You can see the same thing because route of transmission is same countries. Number of deaths, more of number in understanding. What more you should understand about hepatitis E epidemiology is there two pattern of hepatitis E epidemiology. There are four genotypes, genotype 1, 2, 3, and 4, where genotype 1 and 2 are behaving in one type of epidemiology, and 3, 4 is different. That will come probably in another slide. In India, we have genotype 1. Genotype 1 means it is causing only acute hepatitis and not causing chronic hepatitis. And it is more common in immunocompetent people, means healthy people like us. But genotype 3 and 4 is causing chronic hepatitis. That is why we have kept one session on chronic hepatitis in one of our agenda is there about chronic hepatitis, and it is found in immunocompromised population. So we should understand that two type of HEV. If you come to Southeast Asia region, there are 6-7 region of WHO. India is part of Southeast Asia region, where there are 11 countries. There are 10 other countries other than India, Nepal, Bhutan, Bangladesh, etc. So if you see there, that is the Southeast Asia region, entire green one, the fluorescent green country. Here the 26% of the total population lies in this part of the world, global population, 26%. And out of this 26%, probably 70% is in India itself. 67% of Southeast Asia region population is in India itself. And another major country is Indonesia and Bangladesh. Other countries are very small. So a specific problem in Southeast Asia region in relation to hepatitis is we don't have finances. We have lack of awareness about its transmission, prevention, and management. We have very limited policy. Now the national program is started. We have no surveillance system, weak estimate of disease burden. We don't know. We don't know how much, how much is the disease burden, and we have very limited preventive services. Water quality and sanitation is a problem. Testing facility for detection of chronic hepatitis B and C. Earlier it was not there, now it is easily available because of COVID. And access to treatment, it was very costly. Now fortunately it is available free of cost through national program. And limited spending on public health, limited allocation of funds. So these are the problem why we don't have hepatitis care in India. These are Southeast Asia region, you can see most of the burden, 62 is chronic hepatitis B, C. It's more of a number. You need not to think about it. This is an important number which you should remember, that what is the prevalence of hepatitis B in Southeast Asia region. In India, which is a part of Southeast Asia region, it is 2%. This is African region, European region, Western Pacific region, and these are the other WHO regions. So in Southeast Asia region, it is 2%. In India, it's something around 3%. So this is the same thing given in chart, that where the maximum prevalence of hepatitis B is in Western Pacific region. We are very away from Western Pacific region, but still our burden is high. In Southeast Asia region, 40 million roughly hepatitis B patients are there, but these estimates are very, very rough, so you cannot rely on them. Hepatitis C, it is 0.5. So two number you should keep in mind, that Hep C prevalence is 0.5, Hep B prevalence is 2%. If you can remember this much, it is more than enough. Hepatitis burden in India specifically, HBsAg prevalence is 2.9% from global burden of disease data published in 2023 or 22, which turns to roughly 40 million people who are infected, means 4 crore people who need HBV evaluation in our country. Very big number. Anti-HCV prevalence is 0.8%, turning to 11 million population. This was my work, which not this one, sorry. This is the global burden of disease data. We're showing the India how much total death caused by various hepatitis A, B, cirrhosis, hepatocellular carcinoma. So this is more of a numbers, need not to remember. Just for the sake of completion, those who are more interested to know about these numbers, they can go back and read. So at global level, hepatitis is a major public health problem and accounts for significant number of deaths. Its death number is increasing, morbidity is increasing. Majority of death, majority means 96% of death due to hepatitis are caused by hepatitis B and C, and even in B and C, B is taking care of something around 2/3 of the death, and Hep C is 1/3. Prevalence of B is 3.5% and C is roughly 1%. So in India, it is 3% and 1% B and C. If you take Southeast Asia region, it is 0.5% and 2%. We are living in India, so we should know for India, it is 3% Hep B and 1% Hep C. So you have any question, we can answer at the end of this session. Is the question answered? No, what is it?